Good morning, everyone. My name is Colleen Hernandez with CGI Business Solutions. I have worked with eCapital for several years, so I know that some of you are probably already familiar with me. We're going to be reviewing benefits that are to start on July 1st, running through August 31st. So the plan is going to be for 13 months. A couple of things that I did want to mention, please. Number one is I will need elections completed by Tuesday of next week, please, in order to submit your information to the new carrier so that everybody is able to get their information in a timely fashion. We'll talk more about that in a few moments, though. So excited to announce we got a couple changes going on. Like I said, we're renewing July 1st instead of the typical September 1st. Next year, we will be renewing again September 1st, though. Also, we are making a switch right now from Cigna over to Meritain using the Aetna network. Meritain is part of the Aetna family and still offers a large national network of providers for everyone to utilize. We're going to be looking at this 22-page document up on this screen. Not going to take up too much of your time going into a bunch of details, but I do want to touch upon a couple of key features. Number one, the elections that you make will begin on July 1st, and you will be locked into those plan elections through September 1st, 2023. So it is important that you understand what you are picking, because the only time you're able to make any kind of changes is if you experience a qualifying event. I also wanted to point out that while your plan is changing right now, those of you who have elected the flexible spending or the dependent care account, you do not have the option of changing that. That is remaining in effect. You cannot change it. It began January 1st and will remain through December 31st. We will have a special open enrollment to handle the flexible spending and dependent care in December for a January 1st effective date. So while you're going through the enrollment process right now, you will not see those plans as an option. First page of the benefit guide is going to talk about how you can locate a participating provider, both medical, dental, and vision providers. Can you mute yourself, please? Because I don't think I am muting you when I'm... Thank you. Dental vision, no changes at all whatsoever, so that is status quo. Medical, again, has changed using the Aetna Choice 2 Open Access Network. Right on the page in red, it's about towards the bottom, more in the middle of the page. Again, please look to make sure that you are visiting in-network providers and locate an urgent care closest to you in the event of emergency. You're not going to stop and check for an urgent care center. You're just going to go to the closest place. So it's always nice to have the information before you need it. We are going to take a look at the next page. We're going to talk about the medical benefits. Again, medical benefits are the only things that are currently changing right now. So July 1st, we're moving to Meritain using the Aetna National Choice POS 2 Open Access Network. You have 3 different plans to choose from. The first plan is the HSA plan, the Health Savings Account. On this plan, you will have deductible responsibility before you have any kind of cost share. So you will need to meet the first $1,500 of your deductible before Aetna will pay anything. After you have met your $1,500 individual deductible, you'll then have either 10% coinsurance or some copays. A couple things to keep in mind is that when you see a copay for the primary up here, $25 copay after deductible, just reinforcing you, that's after your $1,500 individual medical deductible. Down at the bottom, when it comes to your prescription drugs, again, those copays are after your medical deductible. Once you have met your deductible, you'll have, like I said, either the copays or the coinsurance, the 10%. All of that, including the prescription drugs, is rolling towards your out-of-pocket maximum. Once you've satisfied your out-of-pocket maximum, all your services will be covered at no charge to you. A couple of things to keep in mind in general and about this plan. Number one, whatever you have met previously under your Cigna coverage through eCapital will be applied to your Meritain Aetna plan. So if you've already met $1,000 of your deductible, you will see that credited to your account, but it is going to take about 45 days or so before you see that happen. Another thing that I want to talk about is that your deductible and out-of-pocket maximum run on a calendar year. So even though we're renewing July 1st, come January 1st, everything is going to revert back to zero. This is the only plan that will allow you to open a health savings account, banking account, and we're going to talk more about that in a moment. The other two plans, they are copay plans. Work exactly the same. Just want to touch on a couple of things here. Number one, the plan in column number 2, the EPO, Edward Paul Oscar, does not have any out-of-network benefits except in the event of emergency-only coverage. I do want to also draw your attention to 2 sections over here in red called the KISS-X network. Over here, there is a special network of providers for both imaging and surgery, the KISS-X network, that will provide services for MRIs, CAT scans, PET scans, outpatient surgeries at no cost to you. So in the event that you're at a doctor's office and they say, hey, you're going to need an MRI in your shoulder, let's see if we need to do surgery, etc., you are going to want to contact KISS-X, and they will point you in the direction of a KISS-X provider so that you can have that treatment at no cost to you. It is your choice, though. If you choose to go to an in-network non-KISS-X provider, you may do so. However, you will be responsible for deductible and coinsurance. Can everybody mute their line, please? Thank you. The prescription drugs, you're going to have copays for tier 1, 2, 3, 4, 5 indicated below. It is quite possible, though, that if you are taking a medication that is part of a copay assistance plan, or we're able to enroll you in a savings plan, that Smith RX, who works with the Meritain family in your benefits here, will reach out to you. It is important that if somebody from Smith RX reaches out, that I will need you to please return their call, because then they are going to help you to save some money, okay? Can everybody mute their line for me, please? Thank you. Couple other things I wanted to touch upon. This goes true for this insurance and every insurance in general. You'll notice a substantial savings at urgent care versus emergency room. Not only will you see lower member responsibility, but you're also going to see lower wait times, and urgent care, as a reminder, they can do a lot of the same things that emergency rooms can do, including x-rays, stitch you up, you're in, you're out a little bit quicker, less of a headache. Want to point out two additional items here. Number one, telemedicine on both the EPO and the POS2 covered at no charge to you from day one. So you can call into one of the telemedicine providers, speak with an actual MD 24/7. They're able to call in a prescription for you, send it over to the pharmacy, and all of that is at no charge to you. Also, CVS Minute Clinics, they are standalone within the CVS as well as in some Target locations. You're able to see a nurse practitioner over there. Again, no charge to you at all whatsoever. Now, if anybody has any questions, go on ahead, unmute yourself, and let's get into it. And while I'm waiting for any questions, I do want to point out the last thing at the very bottom of this page here, 90-day prescriptions. If anybody has taken a maintenance medication, so a medicine that you take habitually every single month, you can get a 90-day supply either via your retail pharmacy location or by mail order for the cost of only 2 of those prescriptions. So filling a 90-day supply, not only is it more convenient for you, you have to never leave your house if you do mail order, or only go out once instead of every single month for the 3 months, but you're going to save yourself some money as well. Any questions here?
I have a question.
Yes.
Hi, this is Tom.
Hey, Tom.
I'm on the Aetna's Meriton Health's website to look for providers to see if my current doctor will accept this plan.
Yep.
And it asks me to select a plan, and it lists a whole bunch of plans here, but it doesn't list any of the Meriton. Okay, go ahead.
So did you go to the website located on the front page of the benefit guide? It's www.aetna.com/doc/custom/my-Meritain. So it's not the regular Aetna website. Okay. Then under broad medical networks, you're going to see the Aetna Choice POS2 Open Access. It's more towards the top of the page. I believe it's like the second subsection is the broad medical networks. And the Aetna Choice POS2 is the first plan within that subsection, I believe. Did you see that now?
I don't see that. Hold on a
Okay,
second.
give me 1 second. I'm going to give you.
See, when I clicked on the Aetna.com.find-custom-my-Meritain, it says, sorry, we can't find that page.
I am not sure why, because hold on 1 second. I am looking it up as we speak. Hold on, it is slow. So it is possible that the site might be down right now because I'm just circling.
Colleen, it's been down since last night then, because I have been unable to locate a provider list as well, either from the links from Employee Navigator or going directly.
Oh, okay. That is strange because I am on there right now. Are you able to see my screen? So I can go on ahead and I'll copy and paste the link to it in an email to Ivan as well. I'm not sure why we're having issues.
It could be a browser. It could be a browser.
Yeah, it could be. But let me show you right here since I'm on it.
Try a different browser.
I'm gonna type in my zip code right over here. It's actually the third down. the broad medical networks, and it's the Aetna Choice POS 2. And here we can locate our providers. So I will send out the link in an email to Ivan as soon as the call is over. Okay, so I apologize for that. Any other questions?
I have a question. This is Morty Bragg. I noticed in the email that we'll be covered under Cigna from June 1st through July 1st. Is that right?
That is correct.
It's Ivan here. We can talk about that later on today.
But everything prior to July 1st is still Cigna.
Okay.
Any other additional questions right now?
We're from CNH, right, Brad? You're coming from CNH?
Yes, he's a CNH employee.
Okay.
Yeah. We can talk about that later.
Okay.
Hi, I
Perfect.
have a question. This is
Yes.
Jen from CNH. Is there a difference in the cost to us between all of these plans?
There is, and I'm gonna tell you where to find the cost in just a couple of minutes.
Okay.
Some of the other employees are already familiar with the enrollment system, but I will show you guys momentarily. Any other questions
Thank you.
about the medical plans?
Colleen, what would be the question if folks don't want to do the search online for a medical provider, and let's say they have an appointment tomorrow, and what would be the specific verbiage that they should ask
So
to make sure that they're covered?
If you are contacting a provider and asking them if they're in network, it's going to be, are you in network on the Meritain Aetna Choice POS 2 Open Access Plan?
So not do you accept this plan, but
Never ever do
be
you
be
accept.
specific, right?
Yes, you have to say
Can you
in
repeat
network
that?
because you're going to want to ask them if you are in network on the Meritain Aetna Choice POS 2 Open Access Plan. I know that's a mouthful, sorry. They could say, yes, we take it, but they could be out of network. So they would take it, but you would be charged out of network benefits, and it's much more expensive if you choose to go out of network. And if you're on the EPA, you do not even have out of network benefits on the EPO. Okay, I'm gonna move on to the next page. Page 3 talks about how you can download their mobile app for an iPhone, and then page 4 is directions on the Android. Page 5 talks about member portal itself, which I highly suggest every individual sign up for as soon as possible. This will have not only your providers more accessible to you, but it will also have your explanation of benefits on there. So as soon as you get your ID card, I would suggest signing up. Obviously, you can't sign up yet. We haven't submitted the paperwork, but more information on the member portal. Page number 8 talks about the Minute Clinic, which we've touched upon. So on both of the copay plans, covered to you at no cost right away from the get-go. On the HSA plan, it's covered to you at no cost after you satisfy your deductible. Here's information on Teladoc, again, 24/7, access to a licensed medical provider on the 2 copay plans, covered at no cost right from the get-go. And on the HSA, you're covered at no additional cost after you satisfy your deductible. Page 10 talks about some wellness savings that Meritain offers. Page number 11 talks about your health savings account. Do want to just remind everybody, I touched upon this earlier, but you are only eligible for this banking arrangement if you elect to enroll in the Meritain HSA medical product. If you choose either of the two copay plans, you cannot put tax-free money into this HSA account. If you're on the HSA eligible medical plan, then you're able to put money tax-free into a bank account. This is a bank account, so you are the owner of it. In the event that you are to leave eCapital, the money does stay with you. You're able to contribute for 2022 $3,650 if you enroll as an individual, or up to $7,300 if you enroll with family coverage. Anybody over the age of 55 can also put an additional $1,000 in the account. The flexible spending account, which is on the bottom of this page, again, will not have the option to enroll in this plan until January 1st. So if you're already in it, if you already declined it, you are locked into that decision until January, and we'll send communication out in December to go over that. Page number 12 reviews your dental plan. You have two different dental plan options. You have the standard plan, and then you have the enhanced plan. Both of the plans are going to use the Dental Guard Preferred network of benefits. Your standard plan does not include orthodontia for children, and you're given a $1,000 annual benefit. The enhanced plan, not only are you given orthodontia for children, you're given a $1,500 maximum. Can everybody mute themselves, please? So everybody's given a $1,500 annual maximum. And then you're also going to see a lot more services covered at the basic level instead of major, which means less money out of pocket when you use the benefit. Page number 13 just reminds you about some prescription savings. You always have the option of searching for GoodRx for a manufacturer coupon. Also, as a reminder, SmithRx will also be looking for savings for you. If you are taking a medication that is part of a program that SmithRx offers, they will be reaching out to you to get you enrolled in this program. I will need everybody's cooperation, and please return calls and reach out. It's going to save you money and the company as well, which means more affordable insurance moving forward in the future. Vision, you have two different plans to choose from. The benefits within the plans are essentially the same. The networks are the difference. You have the Davis Vision Network or the VSP network to choose from. With the Davis Vision Network, if you need glasses, there's actually an additional $50 allowance provided that vision works, though. That's one of the differences between the benefits themselves. Critical illness, you have the option of enrolling in a critical illness plan. If you're diagnosed with a critical illness, Guardian will pay you directly $10,000 for yourself, $5,000 for your spouse, or $2,500 for your child. Your children are covered at no cost to you, but you must enroll the children if you want them to be covered. If you've already had the option of enrolling in this plan and you declined coverage but now wish to enroll in coverage, you can do so, but you will need complete an evidence of insurability form, which can be found online. Employee assistance program provided to every single person. It's great to help with all issues that you may be having: grief management, child having trouble readjusting back to going to school in person as opposed to online, anxiety, marital issues, substance abuse issues. 3 free face-to-face sessions with a licensed counselor and unlimited telephonic and online support, including building budgets, saving for a house, saving for retirement, saving for that dream vacation, whatever the case may be. You will get a life insurance benefit of $25,000 provided to you at no charge. Thank you, eCapital. However, if you feel that $25,000 is not going to be enough to pass along in the event of your untimely demise, then you will have the option of purchasing additional insurance anywhere from $10,000 to $250,000 for yourself as an employee. You cannot buy life insurance for your spouse if you don't buy life insurance for yourself. So you can only cover a dependent if you are covered on this benefit. Same thing with the critical illness. So if you were offered this benefit before and you chose not to enroll, but you want to now, not a problem, you may do so, but you will need to complete that evidence of insurability. Next, you have the LifeLock. You still have the two different choices. This helps to prevent identity theft. They are also provide credit monitoring if you are on the Benefit Premier program, including credit scores, access to all of the all three bureaus, etc. Page number 17 talks about disability insurance. You have the option of short-term disability and long-term disability. Short-term disability is going to cover up to 60% of your salary in even $100 increments. In the event that you are injured, it'll pay immediately. If you are sick, you have to wait 7 days before the benefit pays out. It'll pay out for up to 13 weeks. Please note that there is a pre-existing condition clause. So if you are going out for a disability that you are already diagnosed with, if you are pregnant and you're going to be going out on disability and you do not already have this benefit, you are not going to be able to collect for the full 13 weeks. You'll only collect for a maximum of 2 weeks for any condition you've already been diagnosed with. Next, long-term disability. Long-term disability will pay up to 60% of your salary to a maximum monthly benefit of $7,500. This benefit is going to pay out until you are retirement age. So if I had to choose between the two benefits, I would really suggest long-term disability because it is quite possible that I would be able to maintain my life and my bills for 13 weeks. But if I were to become disabled today, don't think I'm going to be able to sustain my lifestyle all the way until retirement age. So great benefit to think about. Again, this also has the pre-existing condition limit on here. So you cannot already be disabled and collect. Both of these benefits, if you were offered and you declined, you will need to complete the evidence of insurability before approval. Next page talks about the accident coverage. Accident will pay you directly in the event that you are injured in an accident outside of the workplace. The amount of money you receive is going to depend upon the type of injury and where you seek care and treatment. The money is paid directly to you. You can do whatever you want with that money. It can be used to pay the hospital bills, pay for time out of work, take a vacation, whatever you would like. In addition to paying for an accident, you do have a wellness charge, a wellness benefit of $50. So you can go get a free physical on your medical policy and then submit the claim to your accident coverage, and they will give you a $50 benefit for just using the preventative wellness benefit. Next, information regarding your 401k. If you are interested in enrolling in the 401k, you must be here for 6 months, though. I want to just point that out, and over the age of 20, so 21 and over, in order to enroll in the 401k. Next, we talk about your telemedicine package. This is all covered within the same package. So you'll get Teledoc at no cost to you. So if you're not enrolled on the medical, you can still enroll in this benefit and get Teledoc not only for you, but any of your dependents also. So let's say I myself am covered on the medical plan, but I have myself, my spouse, and 2 kids living with me. We could all be covered under the tele-advocacy package, even though they're not on my medical plan. You also have a discount pet care program, so it includes veterinarians, it includes prescriptions, it includes doggy daycare, it includes the, what else? Treats and toys and all that kind of stuff. Savings on prescription drugs here, alternative medicine, which is a great benefit. I know a lot of people are taking a more holistic approach to their healthcare. Alternative medicine discounts here as well. Plus, you have a piece called Compass Navigator, which is now referred to as Alight. More information on that on page 20, but essentially they're able to assist you in locating in-network providers. They're able to review bills for you to see if there was a billing error, help make appointments for you with different providers, etc. All part of the package. Page 21 talks about how you're able to download the app and register for the site. You will need your group number, which is NFP789. Last page, in my opinion, the most important page of the entire packet, because number one, it's going to have enrollment instructions, which is going to walk you through how you can choose your benefits, as well as the contact information on the bottom of the page. Doesn't matter if you know what the answer is, as long as you know where to find it. So somebody earlier had asked me how they are going to locate the pricing. So page 22 of the benefit guide will tell you the instructions, but you're going to go to employeenavigator.com, click login top right-hand corner, returning users, so anybody that has already registered in the past, they're going to enter their username and password. Don't remember your password, you're going to click forgot password. You will then be sent a link that is going to be sent to your email, and then you'll click on that and reset your password. Brand new users are going to click register as a new user, enter the requested information, first name, last name, your company identifier, which is eCapital, case sensitive, and can be found on the last page of your benefit guide right over here in red. And your PIN number, which are the last four of your social, and your date of birth. If you get an error message saying cannot locate your records, please reach out to myself or Debbie Rito, because that means that something you're entering doesn't match what I have. It could be a dash in your last name, a spelling, we transposed your date of birth, whatever the case may be. Once you are in the system, it is going to take you to a screen that will look like this. Bear with me one second here. Sorry, I have a multi-step authentication here. So your screen is going to look like this. Here you go. Here is Ivan's screen. Ivan already completed his open enrollment. Go, Ivan. So he will have a link where he can make a change. Let me give you somebody that hasn't made their elections yet here. I'm going to go with So if I take a look at Chris's screen, Chris has not completed his enrollment, so you see that green little start enrollment button. You're going to click on that. You're going to go step by step through the options, and when you get to the end, there will be a green button that says click to sign. That is how you know that you are done. Any questions at all, you're going to reach out to either myself, Colleen Hernandez, or Debbie Rito. My telephone and email address is up on the screen right now, and it is also located on the bottom of the benefit guide, both myself and Debbie Rito. Any questions about anything right now?
Hi, good
Hi,
morning.
Colleen.
Oh, I'm sorry, you can go ahead first.
My apologies. Thank you. Hi, Colleen. I was wondering, do you offer a Roth 401k as well?
There are going to be both Roth and traditional, I believe, available to you. Yes.
Yes, that is correct. Both Roth and regular 401k are available.
Yes, to follow up on that question, I wanted to ask about the 401k. Good morning.
Good morning.
If you already are enrolled in a 401k plan, does it just simply roll over?
If you are already enrolled in the eCapital 401k, or are you coming from a entity to eCapital?
No, it's in the eCapital 401k we have right now. I'm just a little confused.
So it's exactly the same. There's nothing to do. That was just information because you can go in, you can make your, you can change the amount that you contribute at any point in time. So if you have it already, nothing is changing there. You don't have to do anything. It's going to be status quo, and it'll just keep doing as it's doing.
Oh, okay. Thank you. Thank you so much.
No problem.
For the 401k, you can reach out to me directly, and I'll be able to answer those questions.
Thank you.
No problem. I do want to mention a couple of things. So remember, folks, you are selecting benefits on Employee Navigator. You are not going to go to ADP for making selections. Do not go to ADP. You're going to go to Employee Navigator, www.employeenavigator.com. That's the benefits enrollment portal that we're using.
And also, as a reminder, I need everybody to complete their benefits by Tuesday, the 24th, please.
I would, my recommendation is enroll as soon as possible. Do not wait until the last minute. Do it today, do it tomorrow. You can always go back before Wednesday at noon and make changes to those selections that you have already made, even if you have finished. But finish your enrollment as soon as possible. And then if you want to make adjustments later before Wednesday at noon, you can do that.
Okay, well, if nobody has any questions, you guys are free to go. Thank you so much for your time. And please, again, reach out to myself or Debbie directly with anything.
Thank you, everyone.
Thank you.
Thank you.